Come in.
Hi, how are you today? My name's Megan. I'm going to be your nurse and I'm going to be discharging you today.
Okay.
Okay. Is it all right if I go ahead and just verify your date of birth and name?
Yes.
All right, I'm going to check your armband. Uh, Verify that your name is Matthew Smith and your date of birth is 7/22/1958.
Yes, ma'am.
All right. So now I'm going over your discharge papers. Do you have any questions for me before I begin?
Yeah. We're getting ready to travel out of the country, and is there any reason why I would not be able to go on this trip for any type of reason?
No, none that I can think of. As long as you just take it easy, you don't go too crazy. Usually after a heart attack or you're coming out of the hospital afterwards, usually it's okay to fly after 10 days. So as long as you're not going before then, if it'll be in the next couple of weeks, that'll be okay. That should be fine.
Okay. I also have allergies that I take Flonase for,
Mm-hmm.
and of course, I was wondering if as soon as possible, how soon I can take these meds.
Well, we don't recommend Flonase because it is a decongestant. And usually what it does is it causes your blood vessels to constrict, which can also cause your blood pressure to rise. And you already have a history of hypertension. You are on medication for hypertension, so we don't want anything to counteract that. So unfortunately, no, you wouldn't be able to take the Flonase.
Okay. So do I actually have some concerns about the deterioration of my health and what I can do, one of my options to deal with the situation, the best way to go about it.
Well, definitely what I would suggest is we do have a social worker here. She could kind of give you some more options as far as like if you were going to be looking into home health or possibly going into a facility if that was, if that's something that you guys wanted to do. That's something you and your wife could talk about with the social worker. But as far as like health wise, I would definitely suggest possibly changing your diet. Try to intake like the least amount of sodium as possible. So, and there are certain foods that you can look at, whatever has the less amount of sodium in it is what I would suggest because you don't want high cholesterol either. And as far as like activity, you can exercise, you can walk, you can do stuff like that. But if you begin to have, pains in your chest, which that could kind of feel like a burning in your chest, it's what we call chest pain is what we call angina. So if you have any of that, I would definitely contact your doctor immediately. And I would no alcohol for at least 2 weeks after you're discharged. You could, once you do start, if you do start want to have a drink again, that's okay, but definitely limit how much you drink. Maybe 2 beverages a day is okay. They actually say that some wine does help with, heart problems, so that's something you could take into account. And do you smoke?
No.
Good, great. And like I said, you want to avoid salty foods, avoid fast food as much as possible. And when you are doing these activities, you want to be able to talk comfortably while you're doing them. And if you begin to have any trouble with that and you begin to have trouble breathing, anything of that sort, I would definitely suggest that you stop doing those activities. And like I said, if you have any chest pain like that while you're doing it, definitely contact your doctor.
So definitely avoid some type of crazy workouts and things.
Absolutely.
As for food, just eat salads.
Pretty much. No, you can have chicken, grilled chicken, not fried. Which, me personally, I love grilled chicken. Grilled chicken is good. But, and you definitely, when you guys are when you are traveling wherever it is that you're going, try to, if you guys are walking a lot, doing a lot of rigorous activity, definitely try to take 30 to 60 minute breaks in between if you can. But you're going to be on vacation, so relax as much as possible. And you want to take it easy the first 4 to 6 weeks. I know it's a long time, but you'll be able to get back into the groove of things again after that once your body is healed properly.
Okay.
Okay. As far as that, I can't think of anything else.
So I'm free to go.
You're free to go.
Awesome.
And as far as your medications, do not stop taking your medications, especially your antiplatelets. You don't want to stop taking them abruptly unless you're instructed to do so by your provider. Just any kind of medications, and you want to take them as prescribed. And as far as your insulin, you definitely want to make sure you're taking your insulin properly and you're injecting your insulin properly. That's very important. Definitely don't stop taking your insulin either. But as far as that, we did prescribe you some aspirin for the mild pain if you have it. It's kind of as needed. As far as your other medications and your paperwork here, I have instructions on how to take them and the side effects that it may cause. Some of them do cause drowsiness, so you can't drive on them. So if you need to drive anywhere, I would suggest you have somebody drive you.
Okay.
Okay? All right, Mr. Smith, you are free to go.
Appreciate it.
All right, thank you.